Hi guys, welcome back to Rising Up with Robbie. We've been gone a little while, but we're back. Today I wanted to talk to you about the importance of physical therapy, occupational therapy, and in some cases, speech therapy. There's a difference between physical therapy and occupational therapy. Occupational therapy, many people think it's to get you back to work, but it's actually to get you back functioning at a level for your activities of daily living. So they're going to help you with dressing, grooming, bathing, joint mobility. They do passive and active range of motion. I have limited movement in my shoulders, so my occupational therapist is working with me on exercises and treatment on movement in my shoulders. She has also put a ladder at the foot of my bed that goes up to about my hips so that I can pull up myself toward the end of the bed and thereby help myself sit. So there's various devices that they can come up with to help you with those activities of daily living. My occupational therapist also helps me with stability and making sure that I'm stable when I sit on the side of the bed. And she also will help me with standing, and again, the stability. Now, it seems that runs over into a physical therapist, and it does a little bit, but your physical therapist is going to be more focused on your mobility, your movement, your ability to take care of yourself, your ability to walk. With my prosthetics, my physical therapist is working diligently to get me walking. I walk with a walker, and I can walk approximately 110 steps. Not consecutively, I do have to stop and rest, but that's okay. The more you rest in between your walking, the stronger you're going to be when you do ambulate. The therapist also works with me on sitting and standing, and I do that multiple times. I actually stand up, sit down, stand up, sit down. 5 times at a time, times 20 repetitions. This is helping to strengthen my thighs and going to help me with my balance in standing, and therefore help me with walking. So physical therapist is a little different than occupational. You're going to hear them referred to as OT and PT. OT for occupational, PT for physical therapy. Another therapist that might be required, depending on your status and your length of time after your surgery, you might need a speech therapist. And that speech therapist is going to help you with swallowing, chewing, breathing exercises, in some cases speaking exercises. So it's going to be a lot different than the other two I talked about. All 3 of the therapies are very important. Make sure that even though you don't feel like doing therapy, that you get up and you do it. You get up, you dress up, and you go forward. So make sure that even though you might be a little tired, that you go through with your therapy, because that's going to strengthen you and make you better in the long run. It's not easy. It's work. Sometimes I get to the point I kind of dread my therapies, but once they start with me, I'm fine. And I discover that it's somewhat entertaining, and it's very emotionally satisfying when I'm finished. So always make sure you follow through with that therapy. Very important. Physical and occupational therapy are your 2 biggest therapies that you're going to have. And like I said, after you get your prosthetics, they're going to work with you on walking. I asked my therapist a couple of months ago, how long does it typically take for a woman my age to ambulate freely without a walker? And he said anywhere from 6 months to 2 years. And I believe it, because your legs, your thighs, even your little calves that are left have weakened because of the surgery and the immobility. So be patient. It can take a while for you to return to full functioning. Be patient with yourself and be patient with the therapist, very important. As always, if you have any questions or comments, make sure you write them in the comments section. And I will answer them as quickly as possible, usually within the next day. Also, remember to subscribe to my channel, please. And I will be back in a week, I hope, or maybe 2 weeks. And I'm going to have as a guest a physical therapist and an occupational therapist, so they can talk to you more about my introduction to their jobs. I look forward to meeting with you again. Take care, be safe, and if you're an amputee, be strong. If you're a person with a lot of medical issues, also be strong. Do the best you possibly can. It will pay off. Thank you, and I look forward to hearing from you. Goodbye.